All right, good evening. Thank you for joining us. My name is Faye D'Souza. This is Live with Faye, where we have a discussion every evening to clear up doubts and be able to understand issues better. The thing that everybody's asking about is the vaccine. So here's what has happened. 20 countries so far have suspended the use of the AstraZeneca vaccine over fears that it may be causing blood clots. Now, from what we understand, there are a couple of things that we have to make very, very clear. Firstly, that the instances of blood clots so far have been 22 individuals out of 3 million. Most of the countries who have chosen to suspend the use of the vaccine are largely in Europe, along with Thailand, Congo, and a couple of other countries outside of Europe. Also, the European regulators have said very clearly that the suspension of the vaccine is a precautionary measure because they're still investigating whether or not there would be a link between the vaccine and the problem of clotting of blood. Now, technically, the Serum Institute COVID vaccine that we're taking is effectively the same. It's the same type of vaccine, although not necessarily the same batch of vaccine. So our attempt is to understand what this means, and if we have any reason at all to be worried. If Europe is doing the right thing by creating more panic at this point, there is one argument that says that basically what Europe is doing is putting more people, far more people, statistically at risk of getting COVID by pausing the vaccine in order to save a very, very small number of people from the blood clots. But we're going to speak really to the experts to find out why this is. Now, remember, we invite people on this show who are experts, who are academically and professionally qualified to comment on the matter. There are no opinions on this show at all. So joining me this evening, Doctors Shahid Jamil, who is a virologist, Dr. Rakesh Mishra, Director at the Center for Cellular and Molecular Biology, and Dr. Sanjeev Bagai, Chairman at Nephron Clinic. Doctors, thank you so much for joining us. Dr. Jamil, if I may please start with you, would you explain to us what the risk of blood clotting in Europe, at least that Europe has reported so far, is? Is this the same type of vaccine we're taking in India right now? And do you see any reason to worry?
Yes, it is the same vaccine, essentially. It's just been, as you said, it's been manufactured by a different company, but the ingredients in the bottle are exactly the same. Now, if you look at the incidence of blood clots at random, that's about 1 blood clot per 1,000 people per year. Now, earlier I was listening to the European Medicines Commissioner.
Yes.
40 reports out of 17 million vaccine doses, one dose. Now, if you just look at numbers and do this statistically, that works out to about 150 random cases of blood clots every week. Here we are talking about 40 cases. So I fail to understand what all this noise is all about. The European Medicine Agency is saying there is no link. WHO is saying there is no link. The UK regulators are saying there is no link. Yet there is all this scare. And I do agree that many more people are being put at risk at a time when they should be taking the vaccine.
Dr. Mishra, same question to you. Do you believe that perhaps the European regulators at this point have acted in panic, or maybe they should have calmed down? Because what's happening effectively is that everyone around the world, including in India, is getting really worried, because if I take my parents to get vaccinated tomorrow, I don't want them to be the one among the 1,000 or the one among the 10,000 that develops the blood clots. That's going to cause nervousness.
Yeah, I think what they've done is a disservice. If you look by the number, it looks like protective against the blood clot and not promoting blood clot, it looks like. So I think the reaction should be more measured, and they can wait for some days and check those things in certain background and all, and not, because see, this creates already we are trying to convince people that please take vaccine. It is not only for you, it is your responsibility to protect others. It's not the one individual who is taking the vaccine. It's a social activity in a way. It's our civil responsibility. Now, on top of that, if these kinds of thing comes and gets amplified as it goes to the media rounds, it's really not good. And all the anything else is there or not, but these vaccines are certainly safe. They have gone through preclinical phase 1, 2, 3 trials, and now so many millions of people have taken this. So I don't think it's very wise to doubt short-term effect of this kind. Long-term effect we are yet to see. But considering these platforms are very standard, and those now the key thing is to ask how long these vaccine will protect and what percent of people will be protected, and safety is the last thing I would worry about. So I think this has not been a very good, wise thing by these countries to do.
So effectively, if I understand this correctly, Dr. Mishra, what you're saying is that out of 100 people, there is a really, really small, maybe less than one person has developed blood clot. It is not linked scientifically yet, proven that blood clotting is linked to the vaccine. But by pausing the vaccine, effectively, the European regulators are putting the entire 100 now at risk. And that's a big problem.
Exactly. Not only stopping the thing, the kind of publicity it goes, lots of people get afraid. Just you ask that whether we should take our parents for this or not, and this kind of thing comes. So people who would have gone tomorrow, now they will wait a few more days. Yes, it is now the time to see. This has been something extraordinary that within a year of pandemic, we have a vaccine which is available. I was one who was really not believing that this will happen. So this is the scientists have done great job, industry has done great job, and I must appreciate the regulatory bodies have come forward, taken the courage and put enough work and put them for the public use. Now it's for up to us to use to the fullest extent rather than bringing these kinds of things which are, it's statistically just simply possible that it's just coincidence. So the damage this will do, and these are a question of time and speed with which vaccinate. If we take too long, then there's a new variant will come and create more trouble for us. So it's now really we should accelerate what we are doing, and rather than getting into such is a safety, but I'm not sure it is really effectively it is safety. It's more of a risk that they are taking.
I want to bring in Dr. Bagai. Dr. Bagai, your voice has now become something very familiar for a lot of people because an audio clip of your voice went viral this week, specifically in which you were explaining what efficacy of the vaccines, mean technically. Now, I got a lot of questions from people, maybe people who recognize that you, generously give us your time on the show as well, saying, does this mean the vaccine doesn't work? That's obviously a misunderstanding of what you have said. But do you want to clarify and explain one more time what you meant by efficacy and why it is important for people to continue to wear their masks, but also to get vaccinated?
Yeah. So very quickly, Faye, I will reiterate what I had said in the message. There is no vaccine in the world which is 100% protective. Otherwise, we would have wiped out the scourge of society and humanity, such as tuberculosis. Although there are some vaccines which have worked brilliantly well, like rotavirus, which is almost 80 to 90% effective on the ground. Measles vaccine has done brilliantly well in controlling measles worldwide, and so on and so forth. But what we talk in terms of efficacy is always in a clinical trial. Effectiveness is on the ground. Now, there are a lot of factors which come onto the ground which decreases the efficacy. It doesn't convert 1:1 ratio. So if it's 80% in clinical trials, you need not get an 80% effectiveness on the ground. But that doesn't mean that the vaccine should not be taken. The vaccine must be taken. It's extremely important. It's the only tool in public health intervention which can prevent and save human lives, prevent disease and save human lives. Even if you come in contact with someone, unfortunately, after your first dose or indeed after your second dose, even if you come in contact, the transmissibility of the virus will be lesser. The infection, if at all you get, will be milder. And the end point is you will be able to save lives. Your critical cases will go down. Now, just a very quick word on what happens after the first dose and the second dose. I won't go into the timelines of when the antibodies builds and the T cell builds and things like that. But even 2 vaccines doesn't mean that you do not take precautions, because the other person who's sitting beside you may be harboring the infection. You may carry the infection and then infect the other near and dear ones in your house, even if you don't manifest with the disease. But just a quick word before I leave, Faye, on the huge news which is in the international with regards to thromboembolic phenomena. Can I have a minute just on that?
Yes, yes, please.
Okay. I think it's important in 3 parts, very quickly, Faye. One is that the general population, in terms of a risk ratio of thromboembolic phenomena, be it deep vein thrombosis, pulmonary embolism, or acute myocardial infarction in which you have a coronary thromboembolic episode, is approximately 0.1%. Now, this becomes 0.5% in a population more than 80. So one is it's age related. Second is it's comorbid related. So if you have diabetes, uncontrolled hypertension, dyslipidemia, you're very fat and obese, you're bound to have a higher risk. So there is a risk stratification score. Having said that, when people with COVID land up, unfortunately, in ICU, the real risk, and this is worldwide data through meta-analysis through Cochrane trials, is approximately 8 to 18%, depending upon the severity. That's the real risk of COVID precipitating thromboembolic phenomena. Now, what is this vaccine all about? It's a weakened vector virus of chimp adenovirus. It contains nothing which is thromboembolic or anything which actually precipitates or enhances any thromboembolic phenomena. The ingredients are basically, apart from the weakened adenovector virus, which is a vector-based technology, is histidine hydrochloride, polysorbate 80, disodium EDD, sucrose, NaCl, which is salt water, and water itself. None of these ingredients are known worldwide to precipitate any thromboembolic phenomenon. The causes of these are 2. One is its nature. You're bound to get these episodes even without vaccination in that particular group at that point of time in their life. So it's age, like I said, it's comorbid. Also, there could be asymptomatic carriers. So just in the end, 30 seconds, asymptomatic carriers can carry the same viral load as the symptomatic patients, except the fact that they don't externally manifest it. Now, these asymptomatic, if you are vaccinated with it, you can precipitate a hyper immune response in which you can precipitate thromboembolic phenomena. You have autoantibodies, you have neutrophilic and macrophages and various kind of biomarkers which come in. So the important point is there is no cause and effect relationship which has been established that this has happened because of the vaccine. That is untrue. Second point is the ratio of the incidence which has been reported in the vaccinated group is 0.0037%, which is about 100 times less than even the normal incidence in normal population, in general population. So this vaccine is safe. We have to keep precautions. If you see a particular reaction, of course, we should investigate it, but don't stall the process. Do not stop the vaccination. This is extremely important to give a message that it is safe. Vaccines must be taken.
So, Doc, just to come back again to your first point where you were explaining efficacy. So even at 62% or 80%, it's better than nothing. So it does make sense to take the vaccine as opposed to opting out of it, doesn't it?
See, in a very rough layman language so that all the viewers can understand, each human being as a body or a host of cells responds differently to a vaccine, right? You will not see the same immune response in the same cohort. Therefore, large trials are done which involve thousands of patients.
Okay.
Even if your effectiveness on the ground is 60%, 70%, it is still worth taking it because it will stop the serious cases from happening. It will stop and break the chain of person-to-person transfer. So please take the vaccine. Do not hesitate. It is safe. There are no serious side effects. And believe me, there is no thromboembolic phenomena or blood clots associated with this vaccine.
All right. Thank you so much. I know that you have to leave, Dr. Bagaya, and I do hope that all 3 of our panelists have been vaccinated because it's good to know that all of our medical professionals and our frontline workers are being vaccinated. Let me take the conversation further with our other 2 guests. Dr. Jamil, there have been some suggestions right now, based on what we know about the vaccine, that the 2 doses be separated more than the 28 days that we're currently piecing it out at. Could you explain to us why there are people who are suggesting that we spread it out by a few more weeks? And if you believe that 28 days is the ideal, gap between the 2 doses?
Yeah, so Faye, before I get to that, there was one point left out in the previous discussion.
Yes, please.
The only way to establish causality of, let's say, blood clots with a vaccine can be done in a clinical trial. In a clinical trial, half the people get the vaccine and half the people get the placebo. Now, if the vaccine was causing this, then you would have many more blood clots in people who get the vaccine compared to people who got the placebo. Thousands of people have taken the vaccine or the placebo in clinical trials. This was not seen in the clinical trial. So suddenly, 40 people out of 17 million, and all this hue and cry is raised, just does not make sense. Let me come to the dosing schedule. So this suggestion that the Oxford-AstraZeneca vaccine can be separated by up to 12 weeks comes from one meta-analysis of 4 different trials of the Oxford-AstraZeneca vaccine, which includes the half-dose, full-dose trial, which was a mistake. It should not have been done, and therefore the data should not even be talked about. Now, if you look at this paper, which unfortunately came in Lancet, the data is quite strange. Many things don't match up. So simply to delay the second shot based on not even a clinical trial, but an observation of 3 or 4 clinical trials, in my view, would be a mistake. At this point, it is important for us to get some protection. It may not be the best protection, but do any of us know what the best protection really is? We don't. So my point is that let best not be the enemy of good here. You have vaccine that has been shown to have reasonable efficacy. Go ahead and take it based on the schedule at which it was tested. It is going to create immense confusion in a country like ours if we start doing all this. Secondly, this suggestion is also for countries where vaccine supplies are limited. So you can get the vaccine to 1 dose to a lot of people and then wait for supplies and you can give to others. We don't have that problem. So my suggestion based on this is just go ahead 4 weeks, maximum 6 weeks, get your second shot. I got Covishield first shot. I'm planning to do that second shot. I'm not waiting 12 weeks.
You're not waiting 12 weeks. So I also want to ask, Dr. Mishra, this question right now. The central government has pointed out that Maharashtra is at the beginning of its 2nd phase. What does this mean, Dr. Mishra, in the sense that are we going to find ourselves, back where we were in April, May last year, Mumbai and Maharashtra being the worst hit at that time? We all remember it all too clearly. Also, we understand that a larger number of people infected by the virus this time around are asymptomatic. Does that mean that we have our, is this a different variant? Do we have better immunity? How do we make sense of these numbers?
We are still not sure if it is different variant. Most likely, as we know that there will be tons of mutations. Almost every patient has a mutation, which may generally be of no consequence. But it can't be ruled out that some new variants are emerging and they are more infectious and less symptomatic, all those things. But that only time will tell when more number of samples are analyzed. But I think the major cause of this is the behavior of the people. we know how this virus spreads. Unless I donate it to someone, nobody will get. So that is what has been the cause. And look at the activities, so many political activities, elections, then marriage, then religious activities. Most of these are avoidable. So I think I'm not comparing with the last year, and I hope it is not the same thing going on in this the way it went last time. And certainly, a lockdown is just simply not affordable. So we have to just wait and see if there is a new variant coming. But the new variant is really not a problem. Your mask will protect, however dangerous or otherwise the new variant is. The method is the same. This time we have even a good tool, which is vaccine, so we can take that. I think we are much better prepared for variety of reasons. Vaccine, as I just said, we understand more of this virus. People now don't panic, they don't run to hospitals the moment they're sneezing, so they know that most of them will be asymptomatic and you can stay home and so on. And of course, there is a better understanding of how to take care of the people. So I think we'll be able to handle it much better. But the crucial thing is going to be people's behavior in how this peak or whatever we may want to call is going to play out.
Right. And finally, Dr. Jamil, there is, of course, a concern that people are not maintaining distance and not wearing their masks. Again, this is in the report that the central government has written to the Maharashtra government, that protocol is not being followed. How dangerous could this be at this point?
Well, it's not just Maharashtra. Protocol is not being followed anywhere. Look at Delhi, look at UP, look at Bihar. I mean, go anywhere. You hardly find people wearing masks. Look, the point is that there are only two sure short ways of protecting yourself. One is COVID appropriate behavior, which includes masks and distancing. The other is vaccine. We worry about, there are people who will worry about every little thing. Should I get the dose at 4 weeks or 12 weeks? Will I develop blood clots? But they will not listen to a simple suggestion to just wear a mask. So this tells me that the response, people are not thinking logically. They are, this is an emotional response. This is not a logical response. So I would say this is a no-brainer. Please wear a mask. Please follow COVID appropriate behavior. Even a vaccine would work better on you if you did that.
So I just want to add, I just cannot resist. I mean, after 1 year, I traveled 2 times through air. And both times you do all kinds of ritual when you reach there and you sit and they give food for people to eat. I mean, just simply absurd for 1 hour, 2 hour flight. We are exposing people in this way. I mean, this is so. I was just totally aghast to see that in the airlines, officially you are given food next to each other to eat. Now, how you eat without exchanging the virus from each other? So there is, I mean, at all level, we somehow thought that just wearing mask for 5 minutes, the whole day we are done. That is not. This education has to go, because that's the only thing that is going to protect you. Vaccine is very good tool. It will help, but you know that it's not 100%. And we don't know whether we are ourselves protected, but we may be spreading. All those things need to be established. These are emergency approved vaccines. These are not final things. They are wonderful tools. It is just fantastic, but we have to wear mask for several months, even we have taken vaccine. To me, even more important is that half the people who have got vaccine, if don't wear, the rest will not know that you have a signature that you are vaccinated, therefore you don't wear mask. It's a kind of culture now we have to have, that everybody wears mask, and it's good to for yourself and for your people who are around you, who matter to you.
All right, so I'm just going to try and sum up what we have discussed so far. What the doctors are saying is effectively this, that in spite of this information that's coming in about blood clots, the instances of blood clots have not been connected to the vaccination. The regulator in Europe, who has decided to hold off on the vaccination, has said so. And even if you consider that the instances are so small that the risk of getting COVID and losing your life to COVID is far greater than the risk of the blood clots. So all of the doctors on the panel recommend that you go ahead and get the vaccine and continue, even after you've gotten the vaccine, to wear your mask, to sanitize, to maintain social distancing, because we still don't know everything. You could be vaccinated and protected, which basically means that the virus will not make you sick, but you might be passing it on to somebody else we don't know yet. So that doesn't absolve you from your responsibilities of maintaining COVID, anti-COVID behavior, basically. And that goes out to everyone. Let's remember that Maharashtra is reporting right now about 15,000 cases a day. Other states are also starting now to bring in night curfews, which is Madhya Pradesh. And Gujarat has also announced night curfews. So this is not a time to let our guard down. We have to be careful. We have to remember, none of our professions or our economy or our jobs can handle another lockdown. And it's really up to us to make sure that we don't get to that point. And we have to make sure that we don't leave our governments with any other choice but to lock down, because that's what's going to happen if we continue to behave in the irresponsible fashion that we're behaving right now. I want to leave you there. Thank you, doctors, for making time for us every time and answering our questions so patiently. Thank you for watching. Remember, for our viewers, our 9 p.m. news will be up at 9 p.m. 10 minutes of everything that's happened today without any opinion, no debate, no shouting. That's at 9 p.m. today. Do take a look at it. Share this video and our 9 p.m. news with anyone you feel might benefit from that information. Thank you for watching.
Thank you.